What is diabetes? The term diabetes mellitus describes diseases of abnormal carbohydrate metabolism that are characterized by hyperglycemia. It is associated with a relative or absolute impairment in insulin secretion, along with varying degrees of peripheral resistance to the action of insulin. What are the signs and symptoms of diabetes? You may be diagnosed with diabetes after you go to your doctor because urinate a lot often at night, sores that heal slowly, very thirsty, more infection than usual, lose weight, not in purpose, blurry vision, numb or tingling. What are the different types of diabetes? Type 1. This type is an autoimmune disease in which your immune system attacks and destroys insulin-producing cells in your pancreas for unknown reasons. Up to 10% of people who have diabetes have type 1. It's usually diagnosed in children and young adults, but it can develop at any age. Type 1 diabetes symptoms can develop in just a few weeks or months and can be severe. 2. Prediabetes. This type is the stage before type 2 diabetes. Your blood glucose levels are higher than normal but not high enough to be officially diagnosed with type 2 diabetes. Type 2 diabetes. With this type, your body doesn't make enough insulin or your body's cells don't respond normally to the insulin resistance. This is the most common type of diabetes. It mainly affects adults, but children can have it as well. Type 2 diabetes symptoms can take years to develop. Gestational diabetes. This type develops in some people during pregnancy. Gestational diabetes usually goes away after pregnancy. However, if you have gestational diabetes, you're at a higher risk of developing type 2 diabetes later in life. Gestational diabetes doesn't usually have symptoms. Your doctor should test you for it between 24 and 28 weeks of pregnancy. What are high blood sugar levels? Above 180 to 200 mg per deciliter, mg/dl, or 10 to 11.1 millimoles per liter, mol/L. What should be your ideal blood sugar level? Between 70 mg per deciliter, 3.9 millimoles per liter, and 100 mg per deciliter, 5.6 millimoles per liter. What types of medication will you need? Insulin is a medicine that helps your body use glucose, sugar, for energy. If you have type 1 diabetes, your body cannot produce insulin. You'll need to be prescribed insulin to stop your blood glucose from getting too high. You can inject insulin using an insulin pen. This is a device that helps you inject safely and take the right dose. Some people use an insulin pump instead of a pen. This is a device you attach to your body that gives you small amounts of insulin throughout the day and night. Long-acting insulin may recommend taking insulin detamir, levemir, twice a day. They may recommend insulin glargine, Lantus, Toujeo, Semglee, or abacaglar, if you either cannot take insulin detamir. Prefer to have fewer injections. Insulin glargine is usually taken once a day. They may recommend a type of insulin that lasts for longer, called insulin deglud, Tresiba, if you either get low blood glucose at night. Need help from a carer to take injections. Insulin deglud is taken once a day. Rapid-acting insulin. There are different types and brands of rapid-acting insulin. They may recommend either insulin aspart, Novorapid, Fiasp, or Trurapi, insulin Lispro, Humalog, Admelog, or Lyumjev. Insulin glulicine, Apidra. You'll usually need to take this around 15 minutes before each meal. You'll need to calculate your rapid-acting insulin dose for each meal, depending on the amount of carbohydrates you'll be eating, carb counting. Short-acting insulin, regular or a short-acting insulin may reach the bloodstream 30 minutes after injection and peak 2 to 3 hours afterward. These injections also work up to 3 to 6 hours. Intermediate-acting insulin works about 2 to 4 hours after use, with an average peak time of 12 hours. You can expect this type of insulin to last between 12 and 18 hours. Combination, premixed, insulins. Intensive insulin therapy for patients with type 1 DM should consist of a basal/bolus regimen which can be achieved with a combination of long/intermediate and short or rapid-acting insulins or a continuous infusion of a short or rapid-acting insulin via an insulin pump. Type 2 medication. Type 2 diabetes means your body makes insulin but no longer uses it well. Your body can't make enough insulin to keep your blood sugar levels within an optimal range. The goal of type 2 diabetes treatment is to help your body use insulin better or to get rid of extra glucose in your blood. Most medications for type 2 diabetes are oral drugs. However, insulin or injectables may also be used. Some of these medications are combinations of more than one diabetes drug. Some people with type 2 diabetes may also need to take insulin. The same types of insulin used to treat type 1 diabetes can also treat type 2 diabetes. As with type 1 diabetes, this depends on the type of insulin needed and the severity of your insulin deficiency. These medications help your body break down starchy foods and table sugar. This effect lowers your blood sugar levels. These medications may cause hypoglycemia, low blood sugar. Your risk of hypoglycemia may be greater if you take them with other types of diabetes medications. Therefore, it's important to take them only as prescribed. For best results, take alpha-glucosidase inhibitors before meals. Biguanides decrease how much glucose your liver makes. They also decrease how much glucose your intestines absorb, help your muscles absorb glucose, and make your body more sensitive to insulin. The most common biguanide is metformin. Metformin is considered the most commonly trusted source prescribed oral medication for type 2 diabetes. It can also be combined with other type 2 diabetes medications. Dopamine 2 agonist, bromocriptine, cycloset, Perladel, is a dopamine 2 agonist. It's unknown exactly how this drug treats type 2 diabetes. It may affect rhythms in your body and prevent insulin resistance. Dipeptidyl peptidase for DPP4 inhibitors. DPP4 inhibitors are used to help reduce blood sugar without causing hypoglycemia. DPP4 inhibitors block trusted source, the DPP4 enzyme. This enzyme destroys a hormone called incretin, which normally helps your body produce insulin when it's needed. Incretins also decrease glucose output from the liver when your body doesn't need it. These drugs can also help the pancreas make more insulin. Glucagon-like peptide-1 receptor agonists, GLP-1 receptor agonists. GLP-1 receptor agonists are similar to incretin. A doctor may prescribe them in addition to a diet and exercise plan to help promote better glycemic control. GLP-1 receptor agonists increase how much insulin your body uses and the growth of pancreatic beta cells. They decrease your appetite and how much glucagon your body uses. GLP-1 receptor agonists also slow stomach emptying, which may maximize nutrient absorption from the foods you eat while potentially helping trusted source you maintain or lose weight. Meglitinides. These medications help your body release insulin. However, they're not for everyone. In some cases, they may lower your blood sugar too much, especially trusted source if you have advanced kidney disease. Sodium glucose transport protein 2, SGLT2, inhibitors. SGLT2 inhibitors work by preventing the kidneys from holding on to glucose. Instead, your body gets rid of the glucose through your urine. Again, in cases where atherosclerotic cardiovascular disease, heart failure, or chronic kidney disease predominate, the ADA recommends SGLT2 inhibitors as a possible treatment option. Sulfonylureas. These are among the oldest trusted source diabetes drugs still used today. They work by stimulating the pancreas with the help of beta cells. This causes your body to make more insulin. Thiazolidinediones work by decreasing glucose in your liver. They also help your fat cells use insulin better by targeting trusted source insulin resistance. These drugs come with an increased risk of heart disease. If your doctor prescribes one of these drugs, they will monitor your heart function during treatment. Other drugs. People with type 1 or type 2 diabetes often need to take other medications to treat conditions that are common with diabetes. These drugs can: aspirin for heart health, medications for high cholesterol, high blood pressure medications,